This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hi, everyone. I am April Pruski, and I'm the PM&R HonorHealth Residency Program Director. Just going to talk a little bit in the beginning while Kurt and Zaid set up the slides. So I am the second Residency Program Director and took over starting January of 2023. And I'm excited to share with you all my perspective on why I believe HonorHealth PM&R Residency produces amazing world-class physiatrists. So just a little bit about myself so you can all get to know me. I'm originally a New Yorker who's born and raised in New York City. I did all my schooling in New York. After residency at NYU, I went to Maryland, spent 4 years there in academic practice at Johns Hopkins. And I learned a lot about managing complex inpatients, working with neurorehab patients, including brain injury and stroke. I have worked on various clinical research projects and international research rehab program development. My life goals have always been to pursue an MBA to become a physician administrator, and I completed my fully employed MBA in 2021. When I was thinking about my next steps, I decided I was passionate about veterans, and in October of 2023, I moved out here to Arizona, and I started as the Traumatic Brain Injury Medical Director at the Phoenix VA. And as of July of 2023, I stepped into the new role as a service chief or department director of physical medicine and rehab services at the Phoenix VA. As an educator, I am super passionate about the residents becoming outstanding, well-rounded physiatrists ready to take on practice settings, whether it's private practice, academic, public sector, with focuses on clinical research, academia, or whatever it is that anybody would want to pursue. So that's enough about me. I want to tell you guys what makes me excited about HonorHealth PM&R residency. First, we are the only PM&R residency in all of Arizona. The program graduated its first class in 2022. All of our residents are from around the country, and they're true, real leaders. They begin practicing their leadership skills quite early on by leading teams, participating in adaptive sports, and developing educational curriculums. The residents rotate in all different practice settings, from private rehab hospitals to government settings like the VA, and to private practice physicians' offices, and even in academic settings. We have specialized education curriculums for healthcare disparities, quality improvement, and we also have structured board review and oral board review practice sessions. So this year, we're also developing a practice management curriculum to really help residents learn about what the ins and outs of what it means to be an attending physician. So on that note, I'm happy to introduce Dr. Kurt Heron, who's an amazing PGY3 resident, and Zaid Hayani, who's another amazing PGY3 resident. They've both excelled in our residency, and they're going to give you a bit more details on the HonorHealth PM&R residency program.
Yeah, like Dr. Pruski said, my name is Kurt Heron, and I'm a PGY3. We're happy to share a little bit about our program with you. As you can see, just meeting our current residents, we have two PGY4s, Zeke Clemens, who's our chief, as well as Sam Martin. And then Zaid Hayani and myself are the current PGY3s. And then there are 4 PGY2s. So our program has expanded. We are now taking 4 residents at a time. And those current PGY2s are Eric Anderson, Dylan Kassenbrock, Kasana, and Malik as well. All right, so a little bit about Scottsdale and Phoenix area. Phoenix is the capital. It's as of 2020, it was the 5th most populous city in the US. There are a lot of things to do here, which we'll talk about later. Scottsdale is more of the luxury area of Maricopa County, which includes, the greater Phoenix metro area. It's known for its golf courses, spas, and resorts. We do have a lot of sunny days, over 300 a year. The summers are hot. This was actually a historical July for us on record. So you can escape that though by going up to Flagstaff like I did last weekend. And that just because the summers are hot, that means the winters are amazing. They're perfect. They're in the 40s at the low and highs in the 70s to 80s. So it's perfect weather. So yeah, about 7 to 8 months of that perfect weather. And then you have to bear with maybe 4 to 5 months of the hotter months, but it's okay. We're currently in monsoon season as well, which if you're not from around the Southwest, that's kind of new. It's usually from June 15th to July 15th. This year's been a pretty small monsoon season, but we did have some this morning. And then there's also haboobs, which are just like giant dust storms. I've only seen one in a few years here. So this is just a map of the Phoenix metro area. Scottsdale's circled there. Just so looking at this map, you can see a lot of the residents kind of live on the 51 and 101 intersection. It's pretty affordable. It's a great location within 20 minutes to any hospital you'll be at. Just a little bit about HonorHealth. It's a non-for-profit. There are 6 hospitals, which we'll go show you on the next slide. It's magnet status, which means you can, expect above and beyond care, top-notch care. There's medical groups that have more than 70 primary groups, and then there's also specialty and urgent care locations throughout the valley. This includes the HonorHealth Research Institute, the Virginia Piper Cancer Care, the Cardiovascular Center of Excellence, and the Bob Bowlby Neuroscience Institute, which we do quite a bit of rotations at, and that's where most of the neurosurgeons' outpatient offices are. And then Greenbaum, which we get to do some procedures at as well. And then there's currently 5 residencies with 9 fellowships. It's growing quite a bit, so stay tuned. This is just a map of the hospitals. So you can see the star there is the HonorHealth Rehab Hospital. That's where we're at, just off the 101, just south of HonorHealth Shea, which is majority of the time you're at. And then the Phoenix VA is kind of more downtown Phoenix. You'll spend some time at Osborne doing consults, as well as occasionally at JCL in Deer Valley. And then at TPK, that's where you do your intern year at. A little bit about the PM&R residency itself. So you have, we'll talk about inpatient first. There's 16 blocks total. You start off PGY2 with 7 of your blocks being inpatient, and then it gets less throughout the years, 5 blocks and 4 blocks. Those inpatient rotations include stroke, TBI, spinal cord injury, peds, as well as general rehab. Mostly at that HonorHealth Rehab Hospital where the star was, just south of Shea. But we also do spinal cord injury at Barrow Neurological Institute, as well as peds at the Phoenix Children's Hospital. A typical day is going to start around 8 or so. And it's really nice because it's one-on-one with attendings everywhere you're at. You have a team, like a multidisciplinary conference once a week, either Tuesdays or Wednesdays while you are on inpatient. But the great thing about it is it's Epic EMR, probably the best, at least one of my favorites. You're on home call once a week. So that's 1 night a week and then 1 weekend per month. So in the 4 weeks, you're on call just once per week and then 1 weekend per month. And that's at home, like I said. And then consults, you have 3 blocks total, just 1 block per year. And that's kind of where you'll be at Osborne mostly, and then maybe occasionally go to JCL or Deer Valley. And then it's nice because you get to go on the trauma rounds and be really involved in some of the more extreme cases. Outpatient, that's 15 blocks total. A lot of that is the MSK is at the VA, the Phoenix VA, Carl T. Hayden, as well as some HonorHealth PM&R locations. You have neuro or neurorehabilitation as outpatient, and that's mostly at the VA, and as well as with the HonorHealth neurologist. That's at the Bob Bowlby Institute as well. The sports medicine rotation is with the Mayo Clinic. We have a pain rotation with HonorHealth, PM&R, as well as the VA. And then we do amputee care at the VA and prosthetics as well. And then EMG months are at the VA. So electives. So this is great. You get to start your PGY2 year off with an elective. That's one of the things I really enjoyed. And then you get 2 electives your PGY3 year, and then 3 electives your PGY4 year. Currently, we have addiction medicine, amputee, clinical informatics, quite a few interventional spine rotations at Barrow. We have neuromusculoskeletal pain, spasticity, and dystonia at Banner, orthopedics, a lot of private PM&R pain management, rheumatology, sports medicine, which they have a fellowship at the University of Arizona at Banner. And there's a potential for more. As long as you get the letter signed, you can probably get any rotation that your heart desires in the Valley. Didactics are every Tuesday. We had them this morning. They're from 8 to noon, and attending always lectures there, as well as residents do their presentations, their case presentations, whether that be what they had on inpatient versus EMG, and then ultrasound as well. We have journal club and anatomy lectures as also part of our didactics. And then there's always a therapy lecture. There's usually PT, OT, or speech therapy comes in and speaks with us, gets us more familiar with the actual rehab side of things, and makes you understand exactly what everyone on the team's goal is. Board review, that's great. Like Dr. Pruski said, there's oral board cases, and then we also have questions that we like to run through several different question banks. And then there's also other fun things like spasticity training, backlift and pump refill training, and VR training. Here's just some pictures of our didactics. It's very hands-on. Also, it looks like some team building stuff there. You can see they're practicing spasticity, like injections with Botox. They're with the occupational therapist working on some things over here. Next slide. Just more didactics. You can see the goggles. Yeah, just a lot of fun times, a lot of hands-on. All right, and then I'll turn it over now to Zaid.
All right, sorry, I just had to unmute myself. Hi everyone, I'm Zaid, one of the other PGY3, basically. So I can take it from here. One thing that Kurt didn't mention, we didn't update the slide about, Sam and Zeke, our 2 PGY4s, just got this up and running, but we're in the works of getting a continuity clinic running at one of our clinic sites, actually the one we do our intern year, work with our PCP colleagues over there. And so that's sort of up and running as well. So that's probably something that's going to be like a half day a month or something for follow-ups and managing more general physiatry type patients. So in terms of volunteering opportunities, there's lots of volunteering opportunities in the Valley. And again, there's always a need. We're the only PM&R program in the area, so not too much competition there. There's lots of football, hockey, rugby opportunities, as well as pre-participation physicals. We work with Banner Sports Med, always has a lot of events. So if you're interested in sports medicine, that's definitely an option for you. I just did one a couple months ago and a lot of fun. And then we have this gym on the bottom right, you can see it's called Ability 360. It's one of the best in the country, actually. It's really well known for, it's an entirely adaptive gym. It gets all this funding from places like the NBA. And so it's got a whole workout facility that's all adaptive. They do tons of adaptive sports. And so there's a lot of opportunities to get involved in the area as well. Oops. All right. And then like Kurt touched on earlier, lots of perks of location. I'm originally from the Chicago area and just wanted to change of pace. And so my wife and I love it down here. So in Chicago, if you drive 2 hours, it looks the exact same. But here you can go to Mexico, you can go to Sedona, or a little bit further up to Flagstaff where there's skiing. That I think Kurt and Jesse have been up there a couple times. Grand Canyon's 3 hours away, Vegas, if that's your thing, as well as a short drive over to California too. So lots to do in the Valley. And then in terms of entertainment, that sort of thing, Phoenix is a giant metro area, so you've got NBA, NFL. Golf is something that I learned was a spectator sport when coming out here. So you got the Waste Management Open, which is basically a giant party for a weekend, it seems like. And then things like the Super Bowls here pretty often, it seems like. So lots of things to do. And then I don't know if we touched on it earlier, but we actually rotate. One of the elective opportunities is through Banner Sports Medicine, and they're actually like contracted. They're the sports medicine providers for the Suns, so you get a lot of great hands-on experience with providers who are pretty well renowned in their field. We're basically heading over to treat Suns players here and there, so it's an awesome learning opportunity. And then again, lots of outdoor opportunities in the area: hiking, camping, mountain biking, golf, if that's your thing, and then lots of music festivals too. And then I know every PM&R residency you've probably seen is talking about how much fun they have, but I think we really have a special relationship with everyone in the residency, all of our preceptors and attendings and staff, and everyone is just so cordial and welcome and warm. And I think that's part of being a little bit newer of a residency. We've had 2 graduating classes now, and so everyone's just really working together, as well as just really cordial and having a good time. And we went over and had a Christmas party in an attending's house and that sort of thing. So always having a good time.
5 minutes remaining.
All right, and then I think that's about it. This is a couple of classes ago, so we've grown since. But I'll just throw this up if anyone wants to snap a picture. Feel free to follow us on Instagram. I don't post much. I'm the social media director, I guess. So yeah, if you come here and you're interested in social media, feel free to take it over. But we got feel free to reach out. Lots of different opportunities. Feel free to have emails or DMs, I guess, with any kind of questions. So. And now I guess we can open up to any kind of questions. I don't know if there's any in the chat. Oh, and then I'm not sure if we, I guess while there's any questions roll in, but we might have mentioned it earlier, but we essentially have a certain number of spots that are designated as prelim. So they'll actually be guaranteed spots through the prelim year, and then they'll come into PM&R residency. So this year we've got three interns currently up at Thompson Peak doing their prelim year, and then they'll come with us PGY 2 year, and then one coming from another program. I'm not sure if the numbers are going to change at all next year, but basically Kurt and I both did our intern year here, and I had a great time. I think it really offers a really robust internal medicine baseline training for that first year, and I think we see a really good range of pathology, and I think the residency up in Thompson Peak is really fantastic too. So, oh, and looks like Dr. Prusky just messaged that we got 4 prelim spots linked to the PGY 2 spots for this upcoming year. All right, let's see. Our didactics also available virtually for med students and applicants to attend. I am not sure, actually. I know that we, all of our med students who rotate with us have access to our didactics. I'm not sure if we're opening that up to the general populace at this time.
2 minutes remaining.
All right, our medical students. Oh, yeah, that was the same one there. Do most residents buy or rent? I know people have done both. Kurt and I, pretty sure, are both renting.
So my wife and I are renting a home here on the Phoenix side. But I've known residents that have purchased houses here, usually with a significant other. But in general, I mean, I'm obviously biased coming from Chicago, which is has pretty crazy housing prices, but I feel like it's relatively affordable out here, even though inflation is going crazy. But the program really supports us as well. We had a housing stipend 1 year, and we have travel stipend as well. So I think they really support all the residents. How integrated is the intern year with the PM&R residency itself? We generally sort of, allow them to get all their internal medicine training. They're always welcome to do an elective with us. So we've had one of our prelims do an elective with us as well, just to sort of get their feet wet. And then we don't invite them to like didactics since it's, overlaps with their time, but, we invite them to outings and that sort of thing. So. The step exams are required for consideration. I am not sure.
No, I don't believe so. I think the COMLEX level 1, 2, and 3 would be great. That's just fine. Yeah.
Ashley, good question. Yeah. So I know we're quite the testosterone heavy batch right now. I think part of that's just we've had 2 residents per class for a while. We have one of our incoming, so they're PGY1 right now. Phoebe, so she's coming in, and then Tanae just graduated, Dr. Lopez, and she's working in the area. So we're just at a snapshot where we all happen to be male. So yeah. And then in case anyone's curious, we've had 4 residents graduate so far. One of them did a sports med fellowship, is doing it at Banner, or he already finished it here at Banner U of A. One of them did amputee down in Florida. And then this past year, one of them is doing pain at the Cleveland Clinic, and then Tanae is working in the area. So.
Thank you so much to HonorHealth. Excellent presentation. Y'all are welcome to stay on and answer any of the remaining questions in the chat as we let UC Davis take over. Thank you again.
Thanks, everyone.
Thank you.